Morning, everybody. Glad you can make it with us today. My name is Kelly with the HCA, SURSAC Administrator with you today. First thing I'm going to do is read off the slides and then go over roll call. Disclaimer, this meeting is being recorded and we've posted to the HCA website on a webpage dedicated to, sorry, excuse me, folks, I had the wrong file. Okay, morning, everybody. I'll be reading the disclaimer for SURSAC. Disclaimer, this meeting is being recorded and live streamed on TVW. This meeting is being recorded and will be shared on the HCA website on a page dedicated to SURSAC meeting information. This meeting is open to public disclosure. Please do not disclose any private or confidential information. Highlights for public feedback. There will be 10 minutes at the beginning of the meeting and 10 more minutes near the end of the meeting reserved for public comment. Each person will have 3 minutes to provide feedback. If you're not a committee member and would like to make a comment during a particular discussion, please raise your hand for facilitator awareness. Public comment on that topic will be invited before moving on to the next item. Feedback that is not provided during the meeting can be submitted via email at any time to HCA ESB 5476 at hca.wa.gov. I will now be going over roll call. Ambry leaders. Senator John Braun. Representative Lauren Davis. Representative Dan Griffey. Caleb Bansegreen.
Good morning.
Morning. John Meyer. Alexi Orr. Amber Coe.
I'm here. Good morning.
Randy Flood.
Present. Good morning.
Stormy Howe.
Good morning. Present.
Morning. Chad Enright.
I'm here.
John Hayden.
Good morning.
Nikki Lewis.
Good morning.
Jerry Candelero. James Tillett.
Good morning.
Christine Lynch.
Good morning.
Sarah Gillard.
Good morning.
Morning. Donnell Tanksley. Malika Lamont. Addie Adwell.
Present. Good morning.
Morning. Kevin Ballard.
Present. Good morning.
Hunter McKim. Representative Jamala Taylor. Representative Gina Mossbrocker. Is there anything you'd like to say?
No, just wanted to welcome everyone. Good morning. Hope everyone's holiday weekend was positive and safe. And thanks everyone for joining on a Monday morning, on a cold Monday morning, for our last SURSAC meeting of the year. I was thinking over the weekend that, it's been 3 years, I think almost to the day, since the SURSAC committee first met. And so just reflecting on how fast that time has gone by and how much has been accomplished during that time. Also, can everyone hear me? I'm not sure where the microphone is in this room, so thumbs up for confirmation. Okay, thank you so much. I didn't want to ramble on for 5 or 10 minutes and then have somebody say in the chat, oh, we can't hear you. Okay, all right, back to what I was saying. No, just, 3 years has gone by so fast and just so much has been accomplished in that time. And just really appreciative of all of the time and effort that's gone into participating in the subcommittees back in 2022 and helping support the development of the Substance Use Recovery Services Plan. Thinking about this last year and all the meetings that we've had and some of the updates on plan initiatives, on programs that were funded by the legislature, and just looking forward to the future. As you can see on the agenda, we dedicated a lot of today's meeting time to a mural activity where we can kind of identify which topics or which areas do we want to focus on going forward into 2025. And knowing that we have the number of programs that were captured underneath the Substance Use Recovery Services Plan, as well as new initiatives coming up, like our pharmacy team and clinical quality care transformation just put out a funding opportunity for long-acting injectable buprenorphine, so that smaller providers can have some startup costs reimbursed for the cost to purchase that medication to get more of that LAI bupe out into the community. And so there's constantly new efforts and new work happening. And so just be thinking about when we go into the mural activity, what we want to focus our efforts and intention on in 2025. And so if that's continuing to get updates about the Substance Use Recovery Services Plan initiatives, whether it's health engagement hubs or if it's the efforts to expand training for individuals in the dependency system, also what else is there that's happening within the community and across the state or locally that we would want to highlight or at least get more information about to ensure that our conversations are informed going forward. So with that, no really big announcements other than the fact that the Healthcare Authority was awarded a very competitive grant, a statewide grant under the COSUP, our Bureau of Justice Assistance Comprehensive Opioid Stimulant and Substance Use Site-Based Program. Only 5 states were awarded this grant, and it's a 3-year, $7 million investment into initiatives across Washington state, focusing on different intercepts across the sequential intercept model. And so really excited that, discretionary grant program and that Washington state was selected. The Healthcare Authority will be partnering with Department of Corrections, Department of Health, the Criminal Justice Training Commission, and a number of other, I saw Caleb's note there, and a number of other initiatives across the sequential intercept model, as well as working with some local partners, expanding a lead. Very exciting stuff, and we can kind of have Sarah Melfi-Klein and her team come and present on that or share more in-depth information if anyone's interested. So looking at the chat, we have from Kate, would it be possible for anyone to share the agenda in the chat? It wasn't available under meeting materials on the public website. Kate, apologies for that. We will try to get some access into the chat. And also maybe we can just pull it up real quick if somebody has it handy and can share their screen just so that we can see it, and just kind of go through that real quick. And sorry that it wasn't available on the public website. And then Caleb, Tony, it would be helpful if you remind us of our charter and how our work fits in with other related activities in Washington. Where can we provide added value? Well, I think that's what we're going to discuss during the mural exercise. But I mean, we can refer back to the RCW, the enacting legislation for the SURSAC committee. But I mean, that's a really good point, and maybe we can kind of do a summary of that before we go into the mural exercise, just as a reminder of kind of what exactly is called out in the RCW. If there's no other questions or comments, we can present the agenda, and somebody will get it in the chat, and then we'll move on to the next agenda item. Thanks so much.
All right. Good morning, folks. It is time for public comment. If you are a member of the public and would like to make a comment, please go ahead and raise your hand virtually, and we will take your comment. Again, time for public comment. We have 10 minutes. If you would like to make a comment as a member of the public, please go ahead and raise your hand. Don't see any hands popping up. Last call for public comment. Okay, walk-on requests. Anything that we need to add to the agenda? I know that Caleb had one there that it looks like we're going to talk about. The charter before we get into the mural discussion. Anything else? Hear any other walk-on items? Tony, we're going into the SORP agenda item. Did you want to say anything before we get into that?
No, yeah, I do. And real quick, we're pulling up the charter, finding the most recent finalized charter from 3 years ago, just to kind of refresh everyone's memory on that before the mural exercise. So good call on that, Caleb. And then also just wanted to, before we get into the next agenda item, just thank Chad Enright and John Hayden and Grace O'Connor. We had planned to do a kind of panel presentation or a panel conversation for December's meeting, talking about like kind of where we are post state versus Blake, and having RDA come and share some data that they pulled as well. That was the plan for today's meeting, but we wanted to prioritize the mural piece, and so I did a bad job of coordinating with the team, but just they were willing and available and wanting to kind of come and share, like at least from their associations or their kind of individual experiences, like what's happening in the court system with simple possession cases. So just wanted to kind of, felt like a good time to at least acknowledge their partnership in that, and hopefully we can plan that for some time in 2025. And apologies that it didn't work out today. That was bad planning on my part. So there's that. And then, yeah, just we have Chris Shira here, and this may be an older agenda, but I believe we also have Sharisa Fatinos, the Medicaid director, as well as Tisha Kirschbaum, the director of the Division of Behavioral Health and Recovery, here to talk about kind of a couple conversations about the intersection of the work to support the state opioid and overdose response plan, and how the work that SURSAC's doing kind of intersects with that, and whether there's opportunities to leverage the expertise and the experience and the interest and involvement that SURSAC has had over the past 3 years to support planning and future efforts under the state opioid and overdose response plan. And so we put it on the agenda for a conversation, at least kind of highlighting where we are with the plan and what some of the future efforts are. And I can pass it over to Chris. I know we're a little ahead of schedule, so hopefully Chris is here.
I'm here. Can you hear me?
Yeah, we can hear you.
Oh, great. Yeah, thanks, Tony. Just wanted to mention real quick that Tisha sends her regrets. She was unable to attend today, but we do have Sharisa here. I'm going to give a quick overview of the State Opioid and Overdose Response Plan and the update, where we are in that process, and then turn it over to Sharisa to see if she has any comments, and then we'll see what the SURSAC thinks about potential involvement and input in that work. So thank you, Tony, and the SURSAC team for getting the meeting together and for having me. My name is Chris Shera. I'm the State Opioid Administrator. I'm at the Division of Behavioral Health and Recovery at the Healthcare Authority. And one of the things that I work on is the State Opioid and Overdose Response Plan. This plan has been in some form or other for quite a while, about 20 years or so. And right now we are embarking on I think a pretty significant update of the plan. We've had some successes and challenges in the past, and you know, the plan that we have now, it's good. It's gotten us to where we are now, but it's not quite where we need it to be. And so I'm just going to go over, I got a couple slides I'm going to show, just a few slides to kind of go over, and then I have some questions for the SURSAC committee about potential involvement. So let me go ahead and get my slides up. So I just have a few slides to kind of guide the conversation. So these are the major activities that we're working on right now for updating the State Opioid and Overdose Response Plan. The first one, pretty basic. This group has a charter. The State Opioid and Overdose Response Plan also has a charter, and it's being revised right now to update the various functions, and also to kind of make, I think, clear what the purpose of the plan is, how we want it to be used, and also to provide more detailed information on how the administrative functions are organized, how decisions are made, and things of that nature. So we're working on updating the charter. And once that's finished, I'd be happy to share that. And then also working on an actual draft, the actual document that we will publish. That is also something that's underway. And then we haven't started items 3 or 4 yet, but eventually we will want to engage communities, the public, our state agency partners, tribes, and so on the plan update itself. And then finally, we would incorporate that input and publish the updated plan. Real quick, just a few comments on some of the changes that we are expecting to see with this update. The current version of the plan is 48 pages long. It's got a lot of great information. It's not so much of a plan as it is a compendium of everything that we're doing. It doesn't necessarily identify priorities. It identifies goals and strategies, but I think one might look at it and not necessarily understand like what the state's priorities are, and we want to change that. So an example would, yes.
I'm so sorry to interrupt you, but it looks like for whatever reason, when you did the presentation share, it didn't come through.
Oh, shoot. My apologies. Let me.
And I was bad. I was multitasking and I didn't notice until now, man. I'm sorry.
All right, let me see. Window. There we go. How about now?
Oh, yep. I can tell they're coming. Yeah.
All right, my apologies.
It's not in presentation. Oh, yeah. Just a heads up, it's not in presentation. There you go. Thanks so much.
Yeah.
Sorry.
So these are. Let me back up a little bit. So these are the 4 major components of the update that we're embarking on here. Like I mentioned, approving the charter. We're nearly finished with that. We've been working on a draft document to share, and then items 3 and 4, we're going to work on engaging groups for input on the update, potentially SURSAC. That is why we're here today. And then finally, we would incorporate and publish that input or incorporate that input and publish an updated plan. So I think I just wanted to point out some of the major changes that we would see with this plan. I think the updated charter and an updated plan that would clearly establish what the purpose of the plan is. I think that that's something that we've kind of fallen short on in the past and need to improve on. The current plan is way too long. It's 48 pages. 32 of those pages are just like charts with just strategies, after dozens and dozens of strategies. So it's not so much of a plan as it is a compendium of everything we're doing, which that's good to know. That's good for us to have, but that doesn't really make it accessible or useful to our partners or the public. And one of the shortcomings is that the plan doesn't necessarily enumerate priorities. And so an example of that would be this goal number 2 of the plan is to identify and treat opioid use disorder. A strategy for that goal would be to increase access to medications for opioid use disorder. A priority would be increasing access to medications for opioid use disorder in jails, or increasing access to long-acting injectable buprenorphine, or establishing health engagement hubs, things of that nature. Those would be priorities. So we're going to remove the state agency work plan information, which accounts for like over 30 pages. That information will still be available, but our goal is to have the updated plan be less than 10 pages. And I think we'll be able to do that. And then also, more importantly, we need to be honest with ourselves about what functions can we establish and actually support. I think that we've jumped the shark in the past in terms of forming too many work groups or other administrative functions that we're not necessarily able to support. And so those are things that we're looking to improve on as well. And just in terms of a general timeline, and this is, just sort of a draft timeline, but it's kind of what we've been working on. We started talking about this in October, developing the work plan. The first slide that I showed you with those items 1, 2, 3, and 4, each one of those items you can click on and it pops out a list of activities that we're working on to accomplish these things. We're working on finalizing the charter so that we can have a document to show people exactly what the plan is, who's doing what, how decisions are made, and things of that nature. And also bringing the folks that are, working on the plan or part of the plan, our partners and so on, bringing them closer to the executive sponsors so that they can feel like they're more part of the plan. And so once we get a draft together, that's when we would start socializing that with groups like this and elsewhere. And then by around April, we would work on incorporating that feedback, and then May look to publish and update the plan. And then one thing we've really fallen short on too in the past is having a well-organized process for developing opioid-related recommendations. In the past, we've sort of been prompted to do this because of opioid settlements. So we focused on, making recommendations for opioid settlements, but really the recommendations, I think in the future will probably be a little more agnostic of the funding source, given the uncertainty of opioid settlement funds, when certain settlements will start paying, and the amounts change year by year and things of that nature. So this is the general timeline that we have. And so the question for SURSAC is, how can we leverage SURSAC for input on this process, both from the committee, and what is the potential for SURSAC to assist us with gathering input from individuals with lived experience? And I will pause and turn it over to Teresa to see if you have anything to add.
Thanks, Chris. No, I think that was a nice overview. I think guess what I would add is the way in which we've thought about and approached the state plan has evolved over time. When it started, it was an offshoot of the committee that DOH largely met, probably 2014, when the major overdose deaths related to opiates were for prescription opioids. And really, it was a joint effort between Healthcare Authority and Department of Health, sort of starting to figure out how do we lean into this, how do we respond to this, morphed into the state plan. And now, 10 years later, very different landscape. As settlement dollars became available and support and interest for opioid related activities in terms of medications, nurse care managers that were funded, all the work that you've all been doing over the past 10 years became more active. As settlement dollars became available, it became more an issue of and fentanyl was introduced into the scene. It became an issue for everyone. Initially, it was just folks were looking at it, were paying attention. As it became more impactful, then all the state agencies sat around the table. So we're kind of in an interesting place from a state agency perspective in that we now have everyone at the table, which is great. We have a finite amount of resources through the abatement dollars that those amounts will wax and wane. We've got a continued crisis impacting people's lives. We've thrown on top of that now the use of stimulants for all the reasons that you're aware of. And so we've had to ask ourselves, what is our role as state agencies in helping to support and provide this work? And I think our role is twofold. One is to how do we coordinate across our state agencies that touch people directly and have the opportunity to provide harm reduction support, overdose, education, response materials, treatments for opiate use disorder, outreach. How do we make sure we're not duplicating efforts and we're all communicating, doing that well? So that's our work as state agencies. But more importantly, what should we be doing to address the needs of the people who are providing care, but also people using drugs? And I think, as Chris sort of framed nicely, we need to do both as state agencies and reflect that in the state plan. But how do we go forward getting two pieces of information that it's not necessarily our day job? What are the needs of people who are using drugs? How do we best engage them? And not to say that we don't have, Department of Health does a ton of work through the Drug User Health Program. Caleb and his team, with whom we contract ADAI, do a ton through the Syringe Service Program. We're getting input, but we want to make sure we're broadly getting input. And then from the other sort of scientific perspective, are we leveraging the things that we should be in terms of, best practices? So I think as we're building this plan going forward, and as Chris outlined, how do we sort of keep current, recognizing sort of what our fundamental work is as state agencies to move forward? And so really asking for your help and thoughts about how do we do a better job engaging people who use drugs, the experience of this work group, and giving input into what we're doing. And at the end of the day, honestly, as you well know better than anyone, we make recommendations. We make recommendations for priorities as to how, with the input we receive, we think the opioid settlement dollars should be spent. We make recommendations for new programs that we think would benefit the lives of people who are using drugs. And those recommendations sometimes move forward and sometimes they don't, because they require approval by the governor and the legislature. And we have a new governor who will start January 15th, and we have a huge number of new legislators. Their knowledge and their unknowns. Don't know what the new governor's plan, thoughts, response will be related to, the opioid epidemic. No idea. No idea the knowledge, approach, thinking, anything of the many new legislators will have either. So just kind of want to put all that out there, in that this is a transition time. The good news is we have settlement dollars. We've implemented a ton of programs that are pretty early on. And we are, hopeful that they will make a difference, but just, want to be really just transparent, as it were, about kind of where we are, where we're headed, and really how do we best get information so we can put forward recommendations that are informed, reflect the needs of people using drugs, and also don't ignore what we know about the current science and ways in which we should be intervening.
I'll just close with saying if, as to the question for SURSAC, as far as what input, if any, would this committee like to have on the plan update? If this is something that the committee is interested in, then once we have a draft document prepared and ready to share, which I think we will have that ready probably before the end of the year. And then we will be looking to schedule our various meeting series for 2025. Then if this committee does want to have input, then I would come back with potentially with some of the executive sponsors to go through the draft and to discuss the priorities, the actual priorities that would be in the plan. So that's what that might look like. But ultimately, this is an ask that we have for the committee. And so we would like to have input from the committee, but also input from as it pleases the committee. So basically, just let us know what input, if any, you would like to have, how you would like to have it, and I'm happy to oblige. Malika.
I think we've got a question from Malika. Malika, go ahead.
Well, hi, Chris. As you know, and Dr. Fatinos, pardon my tardiness, so I missed most of the presentation. However, this is an issue that, is very important. And I think that we should at least have eyes on the plan before it is finalized. I also think that, and you may have said this, and I apologize if I missed it. I think that if there's ways that any of the people that are on the SURSAC work with people that use drugs, have lived and living experience, and are directly impacted by these policies, that we would be able to get input from them in order to be able to add to the plan. One of the things that, and you may have talked about this again, forgive me, but Seattle King County, one of the things that happened is that they did some CDU, so Council of Expert Advisors on Drug Use, which is a program of Vocal Washington, and the Research Expert Advisors on Drug Use went into the community and were able to give folks a small stipend to engage in a process, a focus group process, to be able to bring back information to Seattle on areas to focus on. And I was a part of that process, and it was really impactful for me personally, just like the logical things that people put forward were it was really impactful, and not everything that folks said happened, but there was a concerted effort to engage with people, and they did do some of the suggestions that people put forward. So it just seems to me like organizations that have statewide reach, people that are on both sides of the mountains, are able to be involved in the process. If the state could be able to put forward a stipend so that people can, even if the organization puts in for half of it, the state can contribute some to be able to make it so that people are being paid for their expertise, to bring that to the table. That seems like it would be a doable and important thing to do. And so, yeah, that's my input.
Thank you for the comment, I'm sorry, Malika. So I think we have to be careful too, because, we have there, it's what we want to do and what can we actually accomplish. And sometimes that depends on resource availability. So I think if I had my druthers, that we would, work with an organization, like you said, that has reach on both sides of the mountains. that can access, the community, people with lived experience, and also people that are still in active use. That's something that we're definitely interested in doing, and certainly I think it would be best to work with an organization that has trust in those communities and that has already been working in those communities to mitigate the harms caused by fentanyl, the war on drugs, and so on. And so that's definitely something that I would be interested in learning about your experience and how we could emulate that. And I do think we do have resources to pay stipends, but I'm unsure of whether or not we will have resources with which to, I'm just speaking hypothetically, but to contract with an organization like Vocal Law or the People's Harm Reduction Alliance to help us get input from those folks. And so definitely a great comment and definitely something that we're interested in discussing over the coming weeks.
Okay, any other questions? Chris or Sharisa? Malika, go ahead.
Sorry, I just something else came to my mind, and I don't know if you spoke to this again. Please forgive me because I was late. But I noticed that the OFM budget that was put forward by HCA, it cut MOUD in jails, and it cut RMP lead and arrest and jail alternatives. And so and which are the infrastructure that, we have been building out across the state to be able to help people and to do things that we know work better than, what we used to do. And so I was just wondering, how does that fit into the prior, I'm using air quotes, like priorities
Yeah.
of HCA?
Yeah, so I can address that. So that list was not of cuts. We were asked to write a list of proposed cost savings, call it cut savings, it's semantics at the end of the day. And those we chose programs rather than cutting services. We haven't been asked to do that. We know that we're facing a $3 to $12 billion shortfall over the next 8 years at the state budget. Hopefully, the next forecast will prove that wrong, but we don't want to go back and do things like, well, we're just going to cut adult dental because it's optional. I mean, those are the kind of things that we're all worried about. That said, the MOUD in jails, we do have a waiver that will allow for jails to bill Medicaid for medications for opiate use disorder, as well as other services. That will start in they are services. You're right, Lisa. They are services. I think that the MOUD in jails will be able to bill Medicaid for the medication as well as the services that they won't be able to do now. So that was a transition period that made sense. As far as the Recovery Navigator piece, again, these were proposals. We have no idea what the governor and his team will do, nor do we know, again, what the new governor's priorities will be. They're a list. They're not decisions. We have no idea what the new governor's priorities will be, and the current governor, we don't know if he'll propose a budget that cuts nothing. We were asked to do an exercise. That was the result of the exercise. I think that if there is concern about a specific service that is on that list, helping us tell a story about why keeping that service is important will be helpful. Because at the end of the day, what we do in budget season is justify every single thing we ask for funding for. Is the infrastructure, the 1115 waiver, The infrastructure is in process. We've been meeting with the jails and their administrators, their providers for the last number of months. There's an RFP out to have a third-party administrator who will help support the billing and the credentialing. So all of that is in process. And so, yeah, the infrastructure is being implemented and in place, and we're having lots of conversations with the carceral facilities, the vast majority of whom are very interested and have expressed interest. So, yeah, that work is ongoing.
All right, we have Malika, and then we'll get to Brandy. Oh, Malika,
Yeah,
Brandy, go ahead.
I was just putting my hand down because I'm notorious
for it.
for beginning to do it. But so it's just like thinking about where we were in 2021 with you know 5476 and then 5536. I mean, the whole point of like that, the beginnings of that work was to make sure that we had a network across the state and infrastructure in places that hadn't had it before, to be able to support people in where they live and to provide care in a specific way for them. And, you know, it's part of it's not the implementation of, you know, system change. It's not just a program. As far as like RMP is concerned, and the lead initiatives across the state, and the rest and jail alternative initiatives across the state. So it seems, I don't know, is HCA ready and prepared to be able to tell that story, or do the places that and I'm sincerely asking that question, like, or what do you need from folks across the state to be able to support you in telling that story?
Good question. I think I need more information to answer that in a useful way that is meaningful to this group. I think if King County RNP has really saved over $8 million, that's extraordinarily compelling. Do we have those same pieces of information everywhere? I think, you know, I can get back to this group, Malika. I don't know. I don't want to just throw out stuff that we may or may not have. And I don't know if we have anyone on the call who collects the information about what we have for the Recovery Navigator program, but for minimum numbers of people served in the different areas would be helpful. And if there are any, you know, is any information like King County about cost saved, that would be really helpful too, because again, if we show that something saves more money than it costs, then that's an easy story for us to tell, and that's a hard decision then for the governor and legislators to say, oh, you're going to cut something that saves money. That's not too bright. So I think though that's exactly the kind of information was.
All right, so Brandy, you're up next.
I don't know exactly if this will make sense. I know we've talked about it before, and I know you guys are talking about budget cuts. And although I'm happy that you guys are making resources or making it where the jails could do Medicaid match and all that, we don't want people to have to go to jail in order to get treatment. And so just throwing that out there, especially in terms of RMP and all that kind of stuff that is cost effective. When we're serving people, we need to be serving people out in the community. People need to be able to access treatment in the community and not go to jail to do that. And so I just want to keep that in mind if the resources are short and we're dumping resources in other places, please keep that in mind.
No, appreciate that comment. And I agree 100%. I mean, in the ideal, no one would have to go to jail. And the idea was not to save money by cutting the money will come from another source, but we don't want people to go to jail. We want diversion programs. We want everything to keep folks out of jail. So that my response was just to the specific question about, you know, why are you cutting money for medications in jail? That's the reason.
All right, thank you. One more from Amber. Oh, Chris, did you have something?
Well, I was just, go ahead, Amber.
Oh, I just kind of want to echo some of what Sorry, I'm in a clinic setting. We have a shared workspace. Some of what Malika and Brandy were saying, and also just to reiterate that, these lead RMP programs, they are infrastructure, and they're saving so much more money, and more importantly, they're saving lives, which are priceless. And I would like that to be part of the story that's told too. Also, when we go by how many people they're serving, like I'm from Walla Walla, most of our BHJSO, which is 9 counties big, by the way, most of those dollars are funneled to Benton Franklin County, which has the highest population. And so I don't see you guys like building more detox facilities or building more treatment facilities or building out any, hard building materials out in the east side of the state. The only option around here is these programs. These programs are those bridges to those services for people. Our nearest detox facility is 2 hours away if we can get a bed, so just want to throw that out there.
Thank you.
I just want to mention real quick, Susan in the chat mentions what criteria was used to decide which program made the list and which programs did not. I don't know, what happens above me in terms of management discussions, but from my desk, everything's on the list. And then it's a matter of whether we have low, medium, high concern about what happens if those things are cut. And what I'm hearing is a lot of concern about the Recovery Navigator program and the information that Kimmy put in the chat. That's the type of information that we would need to make the case to avoid cuts to programs like this. So, at the end of the day, and when we're in this challenging, budget environment, in terms of the programs that I kind of have my eyes on, everything was on the list.
All right. One more from Malika, and we are over time on this, but sounds like important discussion. So Malika, go ahead.
Chris, I just wanted to reiterate that Recovery Navigator program, lead, and arrest and jail alternatives, I would say are all priorities, because in a lot of these communities, the lead and arrest and jail alternative initiatives that folks have been going for years, and they have tried to identify other sources of income, and maybe they have at other times, but as their initiatives have grown and are scaling, or not even I don't think anywhere across the state is up to scale, but like these are huge sources of infrastructure and response, people infrastructure for folks that meet people where they are and don't leave them there. So like, I want to make sure that all three of them are recognized, because communities have been working on these initiatives for quite some time in some places, and it would be a huge impact if that funding went away.
Thank you, Malik.
Go ahead, Teresa.
That's really helpful. Understanding that these are locally focused, as they should be, and that the infrastructure is there. I think, Lisa, we see what we can see at the state level. We don't have sight on the local pieces because that's not our purview. So understanding that our decision really undermines a lot of local builds and infrastructure and things that are working is really helpful. So appreciate the call out, and we will take that back and certainly revisit our thinking and what we're doing. So yeah.
Blake, I know we need to move on, but just some parting thoughts from me. Great discussion and great questions. I appreciate everyone's time. But also just, as we look to 2025, I want to bring it back to the State Opioid and Overdose Response Plan update. If it pleases the committee, we would like to seek input from the committee on that update, and also input from the committee on how we can better seek input from people with lived experience. So food for thought as we look towards 2025.
Awesome. Thank you so much for your presentation. Appreciate it. A lot of good conversation there. Awesome. Tony, any comments on that before we move to the next, the mural activity?
Yeah, thanks so much. And yeah, we're running a little bit behind, but I agree. Helpful conversation. And Chris, if anybody on the committee or even community members that are attending, would they contact you if they have any kind of thoughts about how best to engage individuals with lived experience or living experience?
Yes, people can feel free to contact me. And also, like I said, I'm happy to come back to this committee, at a meeting in 2025 to discuss that further and to provide updates on plan development.
Okay, thanks so much. And then just regarding the conversation around the OFM programs that were identified as potential budget cut areas and the intersection with Recovery Navigator Program, AJA, and LEAD. Just like when the questions, if there are any follow-up questions or additional information that comes from OFM to the Healthcare Authority, those questions are filtered through my team. And so just know that we are responding in a way that reflects how impactful those programs are being when those questions come through. I haven't seen any requests for additional information. But obviously, if there's an opportunity to, we collect success stories and we collect quantitative and qualitative data for RNP. And so just wanted to note that, obviously that's something that I'm involved in when we respond to OFM. And so this conversation was really helpful just to kind of further reinforce what I already know and have known for the past 5 years working on those programs, that they have significant impacts in the community. So just appreciate all the comments and conversation around there. And since I'm talking, sorry. No, as I say, let's go ahead and segue into the mural activity. And I think this is a really helpful conversation. Thanks so much, Chris, for being here, and Sharisa as well for talking about SORP. I just want to really call out real quick the amount of work that Kelly and Michelle Martinez put into putting this together. This is something that we put a lot of thought into. We want to be, responsive to input and make sure that we're considering how this meeting time is used, as well as the conversations and the space that we're holding and what we're focusing on. And so before I pass it over to Kelly and Michelle, Caleb had brought up kind of revisiting our charter and kind of understanding how, in what ways do we consider programs that aren't directly reflected in the Substance Use Recovery Services Plan. And so, just real quick, I'm going to share my screen real quick. Michelle found the charter because we put it together 3 years ago. So it took a little bit of time to kind of dig that up. But, really when we built the charter, and I can tell that the screen sharing is coming through. Okay, great. I just want to highlight this area here. We're in the kind of progress reporting on implementation of the Substance Use Recovery Services Plan. And so if you see here on this table, we're submitting this every year, and we'll be submitting it every year through the end of December 2026, when the RCW that enacted SURSAC will basically sunset. And so what we want to consider, when we're looking into 2025, is this part here. I'm trying to highlight it, but it's not working. This report shall include progress on the substance use disorder continuum of care, including availability of outreach, treatment, and recovery support services statewide. That's in addition to the specific programs that are identified in the Substance Use Recovery Services Plan. So this progress report, we're talking about the plan. We're saying, hey, this element of the plan, this is where we're at. Here's some data that we've collected. pros, cons, barriers, challenges, successes. But then also within that report, the legislature, and this is taken directly from the RCW, the legislature directs us to also look at the full continuum of what's happening. And so I think that really kind of opens the door, and I'm going to stop screen sharing. I think that opens the door for us to kind of really consider, like, you know, and this is a great follow-up to the conversation we just had, like, where are there gaps, or where do we want to talk more, where do we want to focus more of our energy? And so, Caleb, great recommendation. Hopefully kind of bringing it back to that charter and like calling out that one sentence from the RCW is helpful. And I'll pass it over to Kelly.
Thank you, Tony.
Well, first, real quick, any questions about that? Or comments or clarification? Yeah, Caleb, go ahead.
Yeah, I think what I'm just trying to get at is this is an enormous group of people with a lot of different perspectives and a lot of expertise in different areas. There's a lot going on at the ground level with folks who use drugs and communities, just tremendous need. And there's big systems changes that are coming, like ASAM changes in a year that actually relate to some of our recommendations around assessment. And it's just, I think it's hard. Looks like it's kind of the mural exercise looks like it's more kind of micro process about these meetings and the specific functioning and operations of them. What I'm trying to get is sort of the systems level piece, which is where do we come in? Where do we provide added value? I'm hearing a lot of requests for information that this group can provide around folks who use drugs, lived and living experience, bringing that in, which is great. Is that our only role? Is that? What are the other things that we can do that are added value? And then trying to understand where the agency is and its, let's just say, 4-year strategic plan on each of these topics and understanding how this all fits in. It's super complicated. And the challenge is that you're asking us to give some advice or feedback on the plan, but we need to know the system and the environment which is happening. And I know that this is what I do for a job, and I still have an incomplete picture of that. And other folks don't have that much time. And so how are we supposed to how are we supposed to provide informed input? That's my question.
So that would, I mean, you know, a summary of similar initiatives happening across the state, like that would be something that we could add as a future agenda item. So if you'll see on the mural, you're right, some of it is about process, some of it is about how we schedule these meetings and how we, whether or not the agenda development process is working when we hold the meetings, you know, the process for convening this group. But then also, I think the second piece to that is what do we want to focus on in 2025? And so what I'm hearing is maybe in January, we want to talk about what's happening with the other committees that are working in this area and what are some of their recommendations and kind of an overview of where we are in terms of ASAM implementation and what that means as part of the substance use disorder treatment system, that part of this kind of like intersecting systems that are happening. And so I'm glad you're asking that question and bringing that up, because I think that's a perfect thing for people to be thinking about as they go into this mural exercise, identifying kind of what our next steps are going to be. I think, let's just start throwing, let's do the mural. I love them. I think that this sort of program really kind of helps for like collecting ideas and getting some ideas out there and getting feedback out there. And so I'll pass it off to Kelly and Michelle.
Hey everybody, good morning. So this is the mural. Michelle will be explaining more of it and I'll be controlling the mural. So I just want to point out a couple of things. I sent the link this morning in an email. I sent it before in the email before that. And so everybody should have got an email about 8:30 this morning that has the link to this mural. So just a couple of things about using the mural. One thing that we found out during SEDISA is if you try to look at my mural that's on the screen and look at your own mural, it gets very confusing really quick. I would highly suggest you either look at one or the other, your own computer screen or my computer screen. If you were on a laptop and you were looking at this, use the arrow buttons to go up and down. You click once on the screen and then you can move up and down. and move sideways. And it's a lot easier on a laptop to do that. If you're on a desktop computer with a mouse, or you just have a mouse, you can use your right clicker and you'll be able to move around and such. So I'm going to go ahead and pass it off to Michelle, and she'll be explaining a little more about the mural.
Thanks, Kelly. So before we get started with the first exercise, I just want to let everyone know kind of the whole overview of the mural, because there's actually 3 different exercises on this virtual whiteboard. So first, we're going to talk about the SURSAC structure, like how we run meetings, the recurring agenda items, the communication that we have between meetings, all that kind of logistical stuff. We just want to touch base with the committee about what is fine, what's working, keep it going. And then if you have any ideas for improvement or new suggestions for things related to the overall structure of how we run these meetings, meeting facilitation, etc., that's what that first part will be. The second part is where we're going to get into specific things that you want to talk about, things that you want to learn about, how we should share Caleb's request to understand better what's going on in the statewide level, different systems that are in operation throughout the state. So that's where you'll write in on those blank notes the topics that you want to discuss. Before we start in on that, I do encourage you to read what's already there. We'll try to, combine the ones that are the same or, kind of similar requests. But when we get to that part, what you'll do is use the green dots on the right side to just indicate which topics so if you've written it, you can add a green dot. If you didn't write it, you can add a green dot to indicate that you want to talk about that. So then that way we'll use like the highest interest items for prioritizing what we talk about in 2025. We'll also do our best to, pick what month is the appropriate month to talk about that. So big picture stuff earlier on in the year. If there's an update that we have on a certain topic aligning with a specific month, we'll do it then. But we really just want to make sure that we're prioritizing the conversations and updates that are the most important to you. And rather than using like the Menti style that we did last year where we had options and you ranked them, this is an opportunity to write in your own. So in the email that Kelly sent, you also have a document with the different elements of the SURS plan that are active right now. So you can use that for inspiration, but you don't have to limit your suggestions to the SURS plan. Like Tony had mentioned before, this is, we're talking about the whole continuum of outreach, treatment, recovery support services in the state. So the third part is just going to be deciding on the location for the in-person meeting. And so now that you know what's coming up in this exercise, we'll go ahead and go back to part 1, talking about the SURSAC structure.
Is it just committee members?
And just committee members will link into the mural and write directly in there. However, if you are joining on mobile and you can't participate on your laptop, or you're a member of the public, please feel free to raise your hand or use the chat, and we'll be monitoring that and adding those suggestions in as well. So go ahead and log into the mural if you haven't already. You'll need to log in as a visitor. Everyone's a visitor. Kelly and I are also visitors. You can put your name or stay anonymous. And we'll just give about 5 minutes to see if there's anything additional to add there. Use the purple dots if you have a suggested improvement to something, or you want to talk about that thing. Use the green dot if you think it's going fine. We don't need to make any changes.
And if you do use a purple dot, we'll ask that you share that recommendation.
Right. Yeah. We'll want to follow up with you if you have a purple dot about what you want to change about that thing.
Real quick, just checking in with SURSAC committee members. Is everyone in the mural, or is anybody having any issues with accessing the mural? And just to comment on why we didn't put the mural link in the chat for everyone to join through. As you can see just from the screen being presented, there's like several little bubbles floating around. And with 100 or 80 people in this meeting, having that many bubbles floating around at once, moving the dots and prioritizing and adding comments, it would just be too distracting. So like Michelle said, but at the same time, I think that there's a lot of expertise and involvement with the individuals that attend from the community these meetings. So feel free to use the chat. And if you have any recommendations about how we can better communicate initiatives related to SURSAC or communicate about the agenda, feel free to put those in the chat, as well as agenda item suggestions as well. It looks like Caleb said, I cannot for the life of me figure out how to zoom out. It says to use my mouse and that is not working.
Are you seeing the plus minus and the little zoom percentage in the bottom right corner of your mural, Caleb?
And Sarah put a screenshot of what it looks like, but hopefully that'll help. James says, James, you having trouble accessing? I'm sorry.
James, what's happening when you're clicking the mural link? Are you able to come off mute? Thanks, Caleb.
Sorry, I'm doing it on my phone, so I'm trying to click so many different things. I'm trying to figure it out. I think I clicked the wrong link in my email.
Oh, there is a video, like an instructional video link in there too. So yeah, be sure to click the link that opens the actual mural and then join as a visitor.
And then James, also, like, because you're on your phone, if you're like kind of in transit right now or more, we'll have this open. This link will be open for like the next week. And so obviously we weren't able to get all of the committee members here today. And so, we'll send out kind of like a reminder if like anybody didn't have an opportunity or wanted to think about it and have more time to kind of process. This can be a live process for like the next week at least. And so if you are having any issues right now, isn't that right, Michelle, Kelly?
Yes.
Okay. And then Jane, also, if like there's anything you want to like kind of share now, feel free to use the chat as well. Like if you're like, I got this great idea, but I know for me, I forget things. It happens with age, I guess. But feel free to share either going off mute or in the chat as well.
Okay, you said to just go off mute, so I'm going to do that because I can't actually see this in the app. I can only see it when I'm like looking at it when I come back to this meeting. But I saw something about the about Kratom, and I was trying to add a purple sticker to that because I was thinking that in alignment with the recommendations, the safe supply recommendation from the SURSAC plan, that could be that's in alignment with that, and we should relate it back to that.
Yeah, thanks so much, Nika. And I think that was Hunter McKim, shared some information about some sort of act in another state or some other state efforts. Yeah. But yeah, good recommendation. We can.
And I don't know how to do it on the thing.
Did you want me to indicate that you're interested in that, like supporting that conversation? Because that's part of the section of the mural. We're not quite at that part yet, but if you wanted to talk about Kratom, I'm going to indicate that has your support.
I was just initially trying to put a purple sticky on it as something that I wanted to build on that idea. That's all. That
okay. To build on the idea.
Yeah.
follow up real quick on. All right, just being aware of the time that we have right now. I'm seeing a few purple dots. So if you had flagged the SURSAC SharePoint as something for conversation, if you have a suggestion or it's not working well, if you could speak up and tell us a bit more about that, that would be really helpful. Malika, I see your hand up. Was that you?
And also feel free to just message Kelly directly, send Kelly an email if there's any kind of opportunities for improvement and you've indicated it with a purple dot. For the sake of time, that might help too. I saw real quick in the chat, it looks like from Kate, a question from a member of the public. Is the Safe Supply Workgroup's final report available to the public yet? Great question. It was due December 1st, but at this point, we're in like the final stages of approval before it goes to actually be published. We are hoping by the end of December, so definitely before the legislative session and before January 1st, or at least the first week of January. Those legislative reports are a process, and we just had multiple levels of review and approval, and then we also had just not a lot of time. I mean, in the grand scheme of things, but it's almost there, and we'll make sure for that legislative report, as well as other ones that the SURSAC might be interested in, as well as the community members and members of the public. We'll send it out as part of the SURSAC updates that go out through GovDelivery. So keep an eye on that in the next couple of weeks and through the end of the month, and we'll be sharing some of those relative legislative reports or other information.
And in the interest of time, we're going to ask that those of you that have flagged having walk-on item requested every agenda with the purple dot for follow-up, if you could just email Kelly and I directly to let us know if what you mean by that is to just remove it from the agenda, or you have a different idea for how to improve that piece. That would be really helpful. Thanks to everyone who has figured out how to use purple sticky notes to specify your feedback. That is also really helpful. So
I'm sorry. So there's someone, Hayden, you're writing all over the mural, and I can't delete the stuff. I don't know what's going on. I've never seen this before.
well, I think that's just because he's in writing mode instead of like the arrow click mode. So that's fine. We'll fix it later.
Yeah, we can fix it later.
All right, we're going to go ahead and move down to the agenda items piece. And yeah, and it looks like there have been some additions already, which is wonderful. So I'm just going to read these out loud, so we all know what's already been shared. And then if you want, if you agree that we should talk about that at some point in 2025, please add the green dot. Add a green dot so that we can see the relative interest level among these different topics. So we have presentation about naloxone distribution from DOH. UW to present drug checking network and the Washington State Patrol Crime Lab data. Focus on populations such as veterans and LGBTQ. Kratom Consumer Protection Act and other Kratom topics. Rural healthcare. Contingency management. Presentation on opioid treatment network jail report. SORP SURSAC collaboration. Joint Legislative and Executive Committee on Behavioral Health. Simple possession post. Simple possession post from 5536. After 5536, I got it, yeah. 6109 implementation. That's a bill. Reviewing the housing funding and how it's used. Stimulants, epi data, effective strategy, strategic needs, concrete planning, action, finding ways to serve more rural areas, especially in Eastern Washington, harm reduction, healthcare, and treatment for people in supportive housing, learn what other states are doing that relates to SURSAC, quarterly updates on known opioid mortality statistics for Washington State, lead model education series. I think that's all that's been written down so far.
And people should just use one green dot per item. You can, if you're interested in multiple items, you can put a green dot on multiple items. But if you're really interested in one item, please don't put 5 green dots yourself, so that we can kind of like track overall committee interest.
And keep, double clicking on the blue Post-its there and adding additional content. We tried to capture what has come up in previous meetings. And so the existing Post-its were really kind of a reflection, or just like thinking back and looking at past meetings and saying like, what was something that, that had a conversation about or seemed like there was interest around. And so like, for example, the 6109 implementation, that's the bill that passed in the 2024 legislative session that is really kind of talking about fentanyl presence, the dependency system. Department of Children, Youth and Family Administrative Office of the Courts are really working on implementing a lot of measures there, and HCA supporting. And so just wanted to provide that context for the existing kind of ideas or concepts that were up there. It looks like there's a hand. I don't know.
Oh, is that Addie?
Yeah, hi. I wanted to suggest, in addition to the quarterly updates on known opioid mortality, there are some local health jurisdictions that have funded opioid fatality review committees that are doing deep dives into cases of opioid fatality and coming up with prevention recommendations. And I think it'd be useful to hear from those committees. I think there are 3 that are active right now.
Thank you so much, Addie. I'm just adding a note to that piece to follow up with you around that. Thank you so much. There any committee members that don't have access to the mural that want to verbally add a topic request, or because we can add that, we can type that in for you. And with this mural link will be active long after this meeting, so we will continue to allow input, right, Kelly, for the next week or so. So you'll probably want to spend some time with this and think about it, and we'll revisit at the February meeting. Sorry, January. January is the next one. And so if you didn't have a chance today, you'll have a chance in the next week at least. And so just in the, because we're a little crunched for time still, we'll just move on to that final piece and get some votes for location for the in-person meeting. So the shared screen is going to switch over
Wait, Brandy said, no, there are enough cooks in the kitchen. Yeah, Brandy, fair. And also just, yeah, please feel free, if there's any feedback or something that you've been thinking about, or you're like, gosh, I really feel like we could better use our time in a different way, or by like structuring these conversations and the meetings in a different way, do reach, send an email to Kelly. Everyone has Kelly's email. And so we really want to just make sure that the process is solid and the content is solid. And so, but yeah, you're right. There's a lot kind of happening within Mural. Malika, go ahead.
So I obviously couldn't fit it all on my little sticky, but I put a sticky about a system, like ideal system transformation exercise where we potentially, as the SURSAC, engage in a I don't know if logic model is the correct term, but we engage in a process where we outline what the ideal, like what we would hope the system could look like for working with folks from that are experiencing SUD. So I just wanted to clarify that so like if we were saying, if a person is encountered by law enforcement, this is what we would hope would be, the response process. I think it would be, frankly, it's something that's never really happened in a public meeting before. And I think that could be impactful. And that obviously it's not something that we could do in just one meeting, but it could end up being a series of meetings where we identify different points along the continuum of a system. And we go through a process of identifying what we want it to look like, what we would want it to look like as a group. Does that make sense?
Yeah, and Malika, I made a note to follow up with you about this after everybody votes and everything. So make sure we need more context. We can contact you about it.
Okay, thanks.
Thank you so much.
All right, so we got some green dots coming in on locations for an in-person meeting. And you can choose up to three places. We are definitely, and maybe we have 2 in-person meetings, because I see 4 for Olympia and some for Ellensburg. And we can do like a west side and an east side of the mountains. Just really want to try to have an opportunity to have a maybe hybrid, or at least primarily an in-person SURSAC meeting. Help kind of build these relationships that we've had for 3 years, but we've never really had a chance to, never really did icebreakers or kind of other opportunities to just help the committee members get to know one another. Like I feel like, it's kind of the pros and cons about doing this primarily virtual, is that, some of those kind of opportunities just haven't been there. And so really want to try to make sure this happens in 2025. And so, yeah, just if you haven't had a chance yet, please identify your, 3 places where you would be interested in kind of getting together with other committee members. We would still televise, it would still be recorded, and TVW could still come. We would do a hybrid model, kind of similar to like, but at least maybe have it in a different location other than the Cherry Street Plaza, just to make it a little, less burdensome. Because although it's not that burdensome to come here, you just have to get a visitor pass. It takes like a couple seconds. But anyway, wait, I have a hand up.
Thank you, but
Oh, Malika. Malika, did you have anything else?
Sorry, no, no, sorry.
making your dots bigger doesn't give it more points or anything. So everybody
I didn't even know you could do that though. So that's pretty cool if somebody hacked that. They were able to hack the dot. Got one strong recommendation for Spokane. Hey, noting the time, I just wanted to check in. Is our guests from the Salish BHASO here, and is Salish ready to go with our RMP presentation, or?
Hi there. This is Kelsey Clary from Salish. We do have all of our folks on the call, but we were planning on we're ready to start whenever you are.
Awesome. Let's transition out of this, and so maybe in like 3 minutes we'll get started. But Michelle or Kelly, any closing?
Yeah, I just want to let you know, remind you again, the mural link is active. It's like an actual whiteboard where it doesn't get saved. Any changes you do to it, anything you add, that just, it's automatically updated. And it'll be live. We'll try to remind you to add and continue to, participate in it, especially those that have missed today's meeting, for the next week or so. And then we will revisit the results for the January meeting and start populating agendas for 2025 based on your input. So thanks everybody. I think that actually went really well. I was worried it might be confusing, but that was that was really informative. So thanks so much for your participation, and we'll go ahead and move on to the next item.
All right, Kelsey, you ready to go?
Yeah, I am. Thank you so much. Good morning, everyone. My name is Kelsey Clary. I'm the regional administrator within the Salish BHO for our Recovery Navigator program. In the Salish region, that is called the REAL program, which stands for Recovery, Empowerment, Advocacy, and Linkage. And the Salish region encapsulates Colum, Jefferson, and Kitsap counties. Today, we wanted to bring with us some of our program staff. We have a couple project managers and one care manager, as well as some of our community champions in each of our counties and the tribes that we work very closely with. So I am going to hand it over to, let me just do a quick scan, the folks we have on from Jefferson County, which would be Sam, if you're able to unmute and get us started.
Hello, my name is Samantha Boyd. I'm trying to turn my camera on, but it's not working. I am filling in for my project manager, Braden Torgler, and I'm going to turn it over to our Sheriff's Navigator, Stephen Nichols.
Hello, all. Can you hear me all right?
Yeah.
All right.
We can. Thanks, Steve.
Yep. So I stated work with the Jefferson County Sheriff's Department as their mental health navigator. And I work often with the REAL team in referring ongoing situations as I co-respond with the deputy department or the sheriff's department. Or often they'll leave an email or something for me asking for me to follow up. And depending on the situation, I will refer people to the REAL team. They have been an awesome help and a great resource to plug people into. Especially in Jefferson County, there are some parts of it that are quite a ways away. And in some cases, I've referred people to them. And despite the distance and the time needed to have them work with these people, they've made several trips down trying to help those people get them informed about what services are available, and then try to get them plugged in. And I just really want to thank them because they've been an awesome help and a great resource to plug people into. I don't know if there's more, if you want more specific or anything, but they're a great resource. And not only myself, I know that the sheriff's deputies in Port Townsend have referred people to them as well.
Thanks so much, Steve. I appreciate you sharing about that and the unique landscape that we have in Jefferson County. We wanted to turn it over next to folks we have on from Kitsap County. So we'll hear from our project managers and a couple of partners that work very closely with the real teams there. And I'll turn it over to Cherish and Frankie.
My name is Cherish Mitchell-Scott. I work here in Kitsap County. I work for the Agape Unlimited Real Team. I am the project manager, and I will hand it on over to Frankie.
Hi guys, my name is Frankie Brzezinski. I'm the project manager for West Sound Treatment Center out of Kitsap County. And I think we are going to ask Sergeant Garrity to share.
Hi, my name is Sergeant Garrity. And what I'd like to say about the real team, I work in Bremerton. I work swing shift, so I'm always working at night until 1 or 2 in the morning. And the real team, when we call, they will come out. It doesn't matter. They'll answer the phone 24/7. They will come to us, which is a great thing if we're on the side of the road or if we're downtown or wherever we're at. They will come and meet this person if they want help and resources. They will also are great resources for the family. That's a big thing because sometimes this person's not ready to go to treatment yet. They're thinking about it. They're kind of on the fence, but the resources, by providing those resources and somebody that the family can call or their friends can call to try to help them is a great thing. They will sit with those people. They will take them from us as far as, I have other details and things and stuff to get to. They will, hey, yeah, we're here. We'll take them. We'll get them up to the hospital. We'll get them their medical clearance. We'll get them, work to get them a detox bed. We'll do all those things, which, relieves law enforcement, and they have the resources to do that we don't have. I mean, I can take somebody to the hospital and drop them off in an ER waiting room and leave. But within an hour, they're going to get frustrated with waiting, and they're just going to get up and walk out, vice going to treatment where somebody's trying to hold their hand and get them there. There is something to be said for striking when the iron's hot, when they're ready to go and they want to go to treatment. Let's get them there. That cuts down on my workload and gets them the help that they truly need. I'd like to just talk just a couple of instances that we've dealt with. I had where the real team has been ridiculously helpful, and you wouldn't. I guess the best way to say this is they, not something that you would think would actually be something in their purview. But I had a deal one night where a lady that had been in recovery had gotten out of recovery and unfortunately relapsed. And when she relapsed, she passed away from a drug overdose. And I knew that her boyfriend had previously been doing that, and they had started kind of dabbling again in that kind of stuff. So I called the real team of all the people to call and said, hey, can you reach out to this guy tonight? Because he's obviously going to have a very rough night. And they said, well, absolutely. So, I don't know where it all ended, but I do know that they reached out and they called the guy and supported him in a really bad time because they have that experience. They've been there, done that, got that t-shirt years ago. So I find the real team to be a great asset for the Bremerton Police Department. And like I said, they'll answer the phone 24/7, and they usually can respond within 15 or 20 minutes, sometimes a little longer, but get to us and then get the people into treatment. So that's really what I got to say.
Thank you for that, Sergeant Garrity. I believe we also have Rochelle here to speak on the behalf of the real team as well.
Before we do that, Rochelle, I just wanted to go to Rep Davis, who had raised her hand.
Thank you. Yeah, thank you so much. And I'm sorry I was late. I was at the King County had their lunch thing this morning. But Sergeant, thank you for the information. I would just love to hear, just if you don't mind sharing ever so quickly, what types of, if you could just give us a flavor of the types of calls where you summon the real team.
So when we ask for the real team, sometimes it's people that are on the sidewalk downtown that are high that want help. Sometimes I've gone to houses where I have an alcoholic adult daughter or whatever, and the parents actually need the help. We're working with Rochelle as our navigator who connects people to services between Rochelle and the real team. They can usually take on that social service aspect of what needs done. If people just ask for assistance, we try to get them connected up. There's all kinds of, I never know how I'm going to run into these people, but we run into them often enough that I carry the cards and I just, here, call them, call Rochelle, call Hanley, our navigator at the police department to connect, to get the social services, because the police aren't the right answer for 90% of those problems. The social services world is the right answer. That's why I'm really grateful to have Rochelle and have Hanley that work in our office, and the real team that connect people up to the services and treatment. I don't know if that helps any, but that's kind of where we're at.
Yeah, no, that's great. Yeah, I was curious about too if you were doing any diversions, people that otherwise would have had an arrestable offense, but are being diverted through the real team.
Well, normally if we have people that if they want to go get treatment and what they have is a chippy, when I say chip, a small warrant, driving while suspended, or most of them are criminal trespass type warrants because they were where they weren't supposed to be. I would rather send them to treatment every time than they can worry about that little legal thing. But we also pass that on to the real team or their treatment people that, hey, they do have this warrant. They need to go take care of that maybe on Monday or Tuesday when they have a chance, make a phone call down to the court. Vice, go to book them into jail just because I came across them. They want help. I'd rather get them help than book them into jail, because the jail's not going to do anything for them, in that short time frame for something like a criminal trespass or something like that. A 2-day jail stay isn't going to fix anything for them, and it's not going to help them. If that's why I find that more important. I think it's to you,
Thanks for that,
Rochelle.
Sergeant Garrity. I'm gonna actually, just in the interest of time, pass it over to our Clallam County program managers who have a couple of their partners, to share as well. But thank you again, Sergeant Garrity.
Alicia, you want to go ahead and introduce yourself? Okay, I will go. Hi, everyone. I'm Stephanie Aiken. I am here in Clallam County with the Real Program Project Manager at Reflections Counseling Services Group. We also have Alicia at Peninsula Behavioral Health. I'm not sure if she's able to unmute. I know she had to call in on her phone. So there's two of us, and again, that's Peninsula Behavioral Health. And then we have Mark Nichols with us, our prosecutor, and then we have Miss Ann Finn Charles from our tribal community. So we will start with Mark. Mark, we can't hear you. Uh-oh, we lost him.
So let's go to Ann so that Mark can figure out his connection.
Can you hear me now?
Oh, yeah. Oh, we can. Thanks, Mark.
Okay, great. Sorry about that. Thank you, Stephanie. My name is Mark Nichols. I'm the elected prosecuting attorney and ex officio coroner for Clallam County. It is my pleasure to join the discussion today as a member of the Real Team Policy Work Group here in Clallam County. I'll start by noting that I've been in the profession of working as a prosecutor on the one hand and a coroner as the other for over 20 years now. And during this time, I have seen the devastation that untreated substance use and mental health disorder has worked on communities across the North Olympic Peninsula. And it's one of the reasons for which I enjoy participating in the Real Team Policy Work Group. It's one of the few opportunities I have as an elected prosecutor to contribute to an effort that is focusing on proactive ways through which to reduce the number of people coming into the criminal justice system. You may not hear about that from prosecutors across the state uniformly, but I firmly believe that we are working at a time in our history with a criminal justice system that is being pushed to the extreme limits of its capabilities. We need to find ways to reduce the number of people coming in. The system is built and I think designed to focus on violent offenders, and it can do a good job with that. But in so many cases, when folks are contending with substance use disorder challenges, mental health disorder challenges, it is vital and imperative that we create off-ramps that prevent them from even coming into the system at all. And the REAL team is so vital in relation to that effort. We work with REAL team here in the county prosecutor's office, with the men and women of law enforcement in Clallam County, and the connections that we have learned about our community partners, the work that they perform, and the opportunity that we have to impart some knowledge regarding the workings of the criminal justice system have really proven to be, I think, a very positive collaboration and partnership. And so I am grateful for the opportunity to present today. Very happy to be participating in REAL. And Kelsey, very happy that you are in place doing the good work that you are. Stephanie, thanks for your labor and efforts as well.
Thank you so much, Mark. Really appreciate you being here.
Thank you, Mark. So next we have Miss Ann, otherwise known as Ann Penn Charles. She's from the Quileute tribe, and she will be going next.
Hachchichoktia Adal Misan Kuliotle. Good morning, everybody. My name is Ann Penn Charles, but everybody knows me as Miss Ann. I am very thankful that we have Kelsey and Stephanie with the REAL team. Living way out here in the very remote rural areas of Clallam County, it is really hard for us to get services for our clients that are in need. Sometimes I'll get a response from somebody through Messenger. A lot of times our clients and our community members will go to a place that has free Wi-Fi that they can use. They'll get a hold of me. A lot of times our clinic and our services, our behavioral services, are available Monday to Wednesday. The lack of having counselors. I connect our clients to the REAL team. A lot of our clients, we can get services, and REAL is willing to go to where they are, from Haw River to the Quileute to Quileute Prairie, sometimes under a bridge in Port Angeles. I connect our clients to them. A lot of times, my community members that I serve don't just live here in La Push. I'll get requests from all over the United States sometimes. So I am able to engage and thankful that the REAL program is willing to help our members no matter where they are. I'm thankful for them. You know, recently we just had an overdose at Forks while we was at a different event, and having people there to help support the family is very important. So, you know, kudos to them. Regardless if our members have insurance or not, that's another barrier that the REAL team was able to help a lot of our clients that we all serve. So I am thankful and always willing to engage and use all of our resources that we have, especially way out here on the far end of the Western Clallam County. Thank you all. Thank you, Kelsey, and thank you, Stephanie.
Thank you, Miss Ann.
Thank you, Miss Ann. And I will give a short spurt. We were going to have a participant that I had served about 2 years ago come in and share the great success that REAL program has helped him successfully get. So he was quite a bit older, had been in his addiction for over 20 years. And he kind of hit a rock bottom, and 2 years ago he said to me, he says, I think I'm ready. I want to be part of my daughter's and my grandchildren's life. I'm getting too old for this stuff. And just recently, he's been calling me throughout the last 2 years to give me updates. He went to inpatient treatment, and then he went to outpatient treatment. And today he graduated his internship. He became a certified peer support, and he is working at the treatment center that he graduated from and is starting his first day of work this morning. So he's having a celebration for his internship, finishing those hours and starting his first day of work. And so super excited for him, and his celebration was during this time, so unfortunately couldn't come. But those are just one of the most amazing stories and the miles that it can go. And I just want to say he was in and out of the systems. He had been in and out of treatment over 15 times. And the one thing he said to me, he goes, no matter what state I was in or if I was ever making sense, he goes, you still would sit down and listen to me. And so just being able to hold safe moments in those safe spaces, I think that is the impact, to let people know, like, no matter how bad it gets, we are going to sit next to you and we're going to walk through this with you. And so he told me that he had never had that experience before, where he had a program that would walk next to him and feed him and do the things to try to get him to a healthier place and feel that hope and that support. So it's just those amazing moments, and just want to share the work it's hard, but it is so worth it when our communities start actually realizing the support that they have, and we can build those safe spaces.
Thanks for sharing that, Stephanie. And sorry that participant couldn't join, but that's a really amazing thing that's happening for him this morning, and that's really exciting. And that's all for us from the Salish region. So thank you again for the time to share about what the Recovery Navigator program, what REAL looks like in our region, and hear from some of the folks doing the work and the folks who work very close with them to do the work.
Awesome. Thank you so much. Appreciate it. Any questions for this group? All right. Thank you so much for being here. Appreciate it. I'm going to kick it back to Tony and Kelly and others in the room to take us out.
Just, real quick before I think Kelly talks about next steps, just thank you so much, Kelsey and Stephanie and Ann and others that came and shared what's happening up in the Salish region. Just thinking, like, as we, the follow-up to the mural exercise, like, also committee members and others be thinking about how we can, like, best present this information as well. Like, Kelsey, I really like the way that you kind of structured it and how you included partners. And I know there was a plan to include somebody like with, that a program participant. That was an amazing story. I love the fact that they weren't available today because of that reason. But I was also thinking maybe next time we can also just like pull up a map of the BHASO regions to remind everyone, like when we're talking about Salish or Great Rivers or Greater Columbia, like what counties that encompasses. Like, I know for me, it took me forever, and I work really closely to this to like kind of really understand like our geographical layout. So just like things like that, like better ways to, replicate and share this helpful information. Go ahead, Stephanie.
I'm sorry. I just want to share, Kelsey does great work in our area in helping keeping us all together. And I just want to say, for the real teams out here in this rural region, I consider it rural because to get to the edge of the county that we are supposed to be serving, I have to drive an hour and 30 minutes just to get to like the furthest of the county. And that's not even including that little piece of West Jefferson. And we're like in the rainforest over here. So we are like driving around. It takes a significant amount of time. It takes, driving time, making sure that, and the limited resources that are out there. When REAL goes out there, is almost non-existent. It is one officer and whatever REAL team member goes out there and the people that need support. The officer told me, he said, it takes hours to get any kind of support. And he is one officer and cannot, and so most of those individuals, they either get arrested or they just never even get a meet and greet. So just the impact of where we are out here and the significance to meet the tribal lands and to show up in those tribal lands and be consistent, it is a really difficult task. And it is a rewarding task, but it's a very difficult task to meet all of those requirements in the amount of time that we have. So my teams and Peninsula Behavioral Health, they are working their butts off to have that coverage and to make sure that every piece of our county feels the support from the REAL program.
Thanks so much for the work that you do, and thank you for sharing that feedback. It's extremely helpful to hear about those barriers and the amount of time that it takes. So thank you for that, Stephanie. So with that, again, thank you to Salish and all the partners that came today. I'm going to pass it off to Kelly to kind of close us out because we only have a couple of minutes, but thanks to everyone for a great meeting.
We are back to the mural. So one part we didn't really show the mural because it's not completed yet, but for right now, where we're at with the next year is what we have planned for January's meeting so far, pending, of course, anything that's like we see from the other part of the mural and such. But as of right now, we have the regular roll call, announcements, early public comment, walk-on items, RMP highlight, and a meeting public comment. And we have a 2025 legislative session anticipated SUD legislation. So we'll have some people come here or we'll have something to report back on possible legislative that could be put up for that's going to have to deal with SUD stuff, such PDAM presentation, and the review of the 2025 mural results.
And just a reminder for PDAMs, that is some of our future efforts around data collection and data validation. It's an agency-wide effort, and we are rolling into the phase where we're going to include Recovery Navigator program under EdFX and PDAMs, and it has to do with how the data is captured and how those data are transmitted. And so it's really a big change. But we wanted to provide an overview, at least have somebody come and talk about what it is, because, obviously we've continued to talk about RNP data and some of the successes and challenges. And so, but yeah, I just wanted to provide that context. Otherwise, somebody might look at that and be like, what is PDAMs? Other than like a really kind of funny acronym.
That is all I have to share.
All right, well, we're right at 11 o'clock. And so thanks again to our guests, and thanks for everyone for sitting through and participating in the mural exercise. And thank you, everyone that came today to support the committee and support the conversation. And thank you to the committee members. We won't see you until after the new year. So I hope everyone has a safe holiday season. Thank you to the direct service providers that are out there serving the most vulnerable and supporting their efforts to be well and be safe. And I hope everyone has a happy new year, and we'll see you in 2025.